survey and research said that one of the biggest indicators of abuse in a family situation, in a mixed family situation, where there is a step parent.
Yeah.
So that increases the probability of harm and abuse for the young people by multifold.
Yep.
And that's the strongest indicator of
Yep.
harm happening because you have a step parent in the household.
Yep.
So what's your observation in the demographic you're working in of that happening, and what are the learnings?
Gosh, I don't know if I answered your first question well enough, but I'll come back. I will come back to that at some stage. Look, where there's been relationship and family breakdown, and there's a new relationship, there is definitely risks around how those families meld and integrate. And some families do it exceptionally well, and some families, of course, do not. And you have a higher risk of youth homelessness. You have a higher risk of not necessarily of all the abuses as much, but there is definitely a higher risk of harm happening where that family system don't gel well. So we do work with a number of families like that, and young people and children like that. And invariably, it's because the idea of families changed, and that capacity of the family to be inclusive of everybody is limited. And it actually might be because the step parent actually doesn't like the child. And it's easier to not like a child when it's not yours. Because all the norms tell us we have to like our own children, we have to love them and like them, and but if you're the step parent, that's a lot more difficult. And when there's been relationship breakdowns and the young people that we work with, that's definitely one of the roads to homelessness. That the child might get kicked out, or the child feels as though they're getting kicked out, or the child is not being treated as well, so they run away. And we do see that quite a bit. And then we also see higher risks for mental health, alcohol and other drug issues, and a couple of other things that happen as a result of that. Because if you can imagine, from a young person's world, you're still creating your identity, who you are, and all of a sudden there's no safe place for you to be. And kids, doesn't matter what their age is, internalise that as something really bad about them, and so self-medicating and doing other things can happen. And I think that kind of answers your question. I think it kind of answers your question. Is it a bigger risk? It can be, yes. But then we also work with children, and there's about 90% of children who come through our sexual abuse services who are harmed by family members, biological family members. So it's not just the step family system.